Hello, everyone. This is Sadia Maksood from the Indiana Criminal Justice Institute. Today, we are hosting a webinar in collaboration with Rethink Tobacco Indiana. Our today's presenter is Kayla Su, who is a Community Outreach Manager at Rethink Tobacco Indiana. Kayla Su is responsible for the day-to-day operation and management of the statewide grant initiative. She works with healthcare providers and partners around the state to provide technical assistance to behavioral health treatment facilities to integrate evidence-based tobacco treatment approaches into their system of care and develop comprehensive tobacco-free grant policies. Prior to joining Rethink Tobacco Indiana, Kayla worked as a quality improvement advisor with a nonprofit healthcare quality improvement consultancy and the Medicare Quality Improvement Organization, while working on contract with the Center of Medicare and Medicaid Services. She worked to improve healthcare around the Hoosier state, specifically relating to the behavioral health integration. Kayla is a trained tobacco treatment specialist and is also a certified UMass TTS trainer with experience in planning, coordinating, and delivering TTS training around the state of Indiana. She serves on the board of directors for the Indiana Society for Public Health Education as a membership director. Kayla is a certified health education specialist and has earned the national certificate in tobacco treatment practice. So without any further delay, let's go to Kayla.
Thank you so much for that introduction, Sadia. And hi, everyone. Welcome. Like she said, my name is Kayla Su. I work with Rethink Tobacco Indiana, and we work with behavioral health bit about that American Lung Association report and then highlight Indiana's state report card and key areas for improvement. And then we'll discuss a little bit more about flavored tobacco use, including the prevalence and the health consequences. And then we'll describe e-cigarette and vaping products, and then provide you a little resources and call to action, things that you can do at your LCC to really help with this initiative. So the State of Tobacco Control, that is the American Lung Association's annual report, which evaluates states and the federal government's actions that they've taken to eliminate the nation's leading cause of preventable death, tobacco use. And so by using proven effective tobacco control laws and policies, that's necessary to save lives. And so over 480,000 adults die every year from tobacco use, and another 16 million adults are living with a tobacco-related disease. And so this year's report is the 19th annual report. It was released earlier this year in January. So the report focuses on the importance of ending tobacco use amid the COVID-19 pandemic, as smoking and exposure to secondhand smoke, they remain leading public health threats. And so the U.S. Surgeon General has conclusively linked smoking to the suppression of the immune system. And the CDC reports that smoking is a risk factor for the most severe COVID-19 symptoms. And so this is especially important for populations and communities that are most impacted overall by tobacco use and secondhand smoke, and who are also facing a disproportionate burden from the pandemic. And so while the smoking rate in the US has declined over the past decades, there's still about 1 in 5 adults, or about 50.6 million Americans, who currently use tobacco products, with majority reporting using combustible products, so products that you can burn, so cigarettes, cigars, and pipes. Including 14% who report using cigarettes, which are the most commonly used tobacco products among adults. So looking at the non-cigarette tobacco products, e-cigarettes were the most commonly used, with 4.5% of adults reporting using these products. And so the highest use of e-cigarettes were among young adults between the ages of 18 and 24 years old, with over half of these young adults reporting that they had never smoked cigarettes. So these are never tobacco users that are now using tobacco, getting addicted to nicotine because of these new e-cigarette and vaping products. And finally, nearly 19% of current tobacco users report using 2 or more tobacco products, which is also known as dual use. And so, as I mentioned, our smoking rates have declined over the years. Significant disparities do exist, especially among different racial and ethnic groups, and due to socioeconomic factors. And so, in particular, the smoking rate remains high among Native Americans and Alaskan Natives at 29.3%, and lesbian, gay, and bisexual adults at nearly 30%. Adults with behavioral health conditions also endure significantly higher rates of smoking compared to adults without a behavioral health condition, at 28.9% of the smoking rate. And so, according to the National Survey on Drug Use and Health, smoking rates are even higher among adults that have a substance use disorder. So that's 42% of the current smoking rate compared to adults without a substance use disorder. And so additionally, again, I mentioned the cigarette smoking rate has declined over the past decade, but 91% of that decline was due to non-menthol cigarettes. And so there are disparities among menthol cigarettes, which are predominantly used by Black Americans and disproportionately used by pregnant women, the LGBTQ plus community, and persons of lower incomes. So over 80% of Black Americans who smoke menthol cigarettes. And so these disparities in menthol cigarettes, they're primarily the result of targeting by the tobacco industry. In a little bit, I'll talk a little bit more about menthol and the risk associated there. So looking at Indiana's report card, and so we were graded in 5 key areas. So the first area is tobacco prevention and cessation funding. And so these are programs that help to stop youth from initiating tobacco use and helping current tobacco users to quit. And so these programs can also run media ads and campaigns to help counter the tobacco industry advertising, which the tobacco industry spends billions and billions of dollars in advertising. And so the CDC best practices, they recommend that states spend $73 million towards their tobacco prevention and cessation funding. And in Indiana, we allocated $7 million, so which is just below 13% of the CDC recommended best practices for funding our prevention and cessation. So we have an F in that category. Looking at smoke-free air, we received a C. So this is how well Indiana protects citizens from secondhand smoke in public places and workplaces. And so happy to say that smoking is prohibited in most public places, but you need to be 8 feet away from an entrance. However, smoking is still allowed in bars and taverns and casinos that do not employ persons under the age of 18 and don't allow persons under the age of 21 to enter. So the statewide policy does not include e-cigarettes, though, which is factored into that grade. I will say that Indiana has made great strides in protecting people from secondhand smoke by passing comprehensive local smoke-free ordinances. So local cities and counties can pass their own ordinances, and they cover about 32.5% of our state population. Next, looking at tobacco taxes, we received an F. Definitely failing in this area. Tobacco taxes are one of the most effective ways to reduce tobacco use, especially among youth. And it really helps to prevent youth initiation of these products, really stopping them from getting addicted to these products in the first place. And so here in Indiana, our cigarette tax is 99 cents. This was last raised in 2007, so over a decade ago, this tax was raised. And so the average state cigarette tax in all of the country, the average tax is $1.91 per pack. And again, Indiana, 99 cents. Previously, we did not have an e-cigarette tax, but as of July 1 of this year, there was one that went into effect for wholesale and closed systems. We also know that states who increase their cigarette tax, so this is a highly debated issue, but states that do increase their cigarette tax, they still receive substantial increases in revenue, even while reducing smoking. And so the higher tobacco taxes, they can really help save money by helping to reduce tobacco-related healthcare costs, especially among the Medicaid program. And so states can really see greater health benefits by increasing the tobacco tax, and also cost savings by allocating this revenue to promote programs that prevent our youth from smoking and helping current tobacco users to quit. In terms of access to cessation services, Indiana, we received a D for this. And so this grade tells us how well we're doing in providing access to medications and counseling to proven methods to help people quit. And so quitting is difficult, and it can often take several times to try to quit before people are successful. And so this grade, it looks at Indiana's Medicaid coverage for tobacco cessation treatments, as well as the state employee health plan coverage and our state investment in our quit line. And so happily that the Medicaid program does cover all 7 FDA-approved tobacco treatment medications. They're all covered, and most counseling is covered. And so I'll remind you that this report was released in January of 2020. There has been some improvements on counseling reimbursement as of July 1 of 2021 of this year. But at the time of this report, most counseling was covered. So not a whole lot of barriers exist to access coverage in terms of Medicaid. And we are an expansion state, so we did expand coverage to those up to 138% of the federal poverty level. Looking at flavored tobacco products, we received an F in this category. So this tells if our state has taken action to eliminate or prohibit the sale of flavored tobacco products. And so since flavored products plays a key role in attracting and addicting kids to these deadly products. And so we received an F because Indiana has no state law or regulation on flavored tobacco products. So just letting the flavored tobacco products roam free. And so the American Lung Association, they had 3 recommendations to be taken by our elected officials. So the first one was to raise the cigarette tax by $2 per pack with parity across all tobacco products, so including e-cigarette products. And then to enact legislation prohibiting the sale of all flavored tobacco products. And then finally, enacting a comprehensive smoke-free air law that does include bars, clubs, and gaming venues. And so the challenge we have is that the tobacco landscape is evolving. There are a variety of tobacco products that are being used by consumers. And so we know that there are a lot of tobacco products out there, and there's a lot of different variation and change within the different tobacco product types. And so e-cigarettes is a really great example. There's so many different types out there, different generations, and these products have quickly rose in popularity among our youth, really so much that the e-cigarette products have really undone all the hard work that we've done in our country to reduce cigarette smoking among youth. And we are now facing a youth vaping epidemic. So I want to go in a little bit more detail about these products. So electronic nicotine delivery systems, or ENDS as the technical term. So these are battery-operated devices that heat a liquid nicotine solution, or it can also contain other substances like THC, CBD, and other drugs, flavorings, and other chemicals to produce an aerosol that users inhale. So it's not harmless water vapor. And you can see these devices look similar in appearance to a variety of things. They look similar to cigarettes, pipes, pens, even flash drives. You can see that over on the right, as well as I've seen some that look like highlighters even. So your writing utensils, things that youth would be using. They go by a lot of different names, more commonly known as e-cigarettes or e-cigs, vapes. I use those interchangeably. Vape pens, mods, tanks, cigalikes. Or they can go by their brand names. So you might have heard of the product called Juul or Blue. Kids might just call them by their brand names. And so a little bit of background about these e-cigarette products. They came over to the US market in 2006, 2007. And so our government did not regulate these products until almost 10 years later. So prior to that, anybody could get a hold of these products. You didn't have to be 18. People could make them themselves at home in their bathtubs. There was no government regulation on these products until August of 2016. where the U.S. Food and Drug Administration, the FDA, had a deeming regulation, which gave the agency authority to regulate these products because they met the definition of tobacco product under the Tobacco Control Act. And so what this did is it established product standards for the agency to regulate the manufacturing, importing, the packaging and distribution, everything in terms of regulating these e-cigarette products, including their components and parts. So diving a little bit deeper, looking at what is in these products, these e-liquid solutions. Well, 99% of all the e-cigarettes you see sold at convenience stores, gas stations, those vape shops, supermarkets, they all contain nicotine. And the average nicotine concentration is only increasing. From 2013 to 2018, there was a 107% increase in the amount of nicotine concentration in these e-liquid products. So they're getting stronger. They also include propylene glycol and vegetable glycerin. And so these two chemicals are called generally recognized as safe, or GRAS, by the FDA for oral consumption, not for inhalation. And so unfortunately, there's no long-term data available to know what inhaling these chemicals are going to do to our bodies over long periods of time. E-liquids, they also contain thousands of flavorings. There's over 7,000 different unique flavorings that are available, majority of which are fruity and candy flavors. And we know that there's a booming popularity in flavored e-cigarette products among youth. And so there have been some recent federal restrictions on flavored products. I'll talk about that in a moment. But again, no long-term data available on the toxicity of inhaling these flavorings over long periods of time. But we do know that many of these flavorings are known respiratory irritants. They can irritate our respiratory system. And then finally, carcinogens, or cancer-causing chemicals. So e-cigarettes, they are not safe. People like to know, like to think that they're safe. They are not safe. They are not. They can contain toxins that deliver harmful cancer-causing chemicals to users. So looking here, formaldehyde, that's the chemical that we use to embalm our loved ones before burying them, formaldehyde, acetaldehyde, acrolein, heavy metals like nickel, lead, cadmium, and copper. Those have been found in e-cigarette products. And really, due to no product standardization and for how long these products were unregulated, there has been no safe level of exposure to be determined for e-cigarette products. So I mentioned flavors. They do play a significant role in attracting youth and young adults to these deadly products. Of course, why else would there be thousands of different flavor options available? You can see a lot of them look like candy, gummy worms, all of the different flavorings. And e-cigarettes, they have been advertised using the same themes and tactics that the tobacco industry has used previously with cigarettes. They know that these sweet flavors and these bright colors are a great way to attract new, young, healthy customers. They're really utilizing the social media platforms as well, social influencers, to increase these products too. But more evidence is coming out that these flavors are dangerous. So far, we know that flavorings can impair lung function and also increase the risk for heart disease. And so youth cite that flavors are the top reasons that they begin using e-cigarette products in the first place. So more than 8 out of 10 current youth e-cigarette users use flavored e-cigarettes. And so you can see the most commonly used flavors on your screen there. I did mention that there have been some federal restrictions. So in January of 2020, the FDA issued a policy that prohibited the sale of pre-filled cartridge-based e-cigarette products, excluding menthol and tobacco flavors. And so this policy is really not foolproof. There were a lot of loopholes here. So it did not apply to disposable products. So we did see a rise in cartridge-based disposable products, so such as puff bars. You might have heard of them. And there are no current federal restrictions on flavored e-liquids. So again, this policy was just for cartridge-based. So it really did get at those pods, those cartridges, but it didn't apply to e-liquids. Although flavored cigarettes, except for menthol, has been banned since 2009 when the Tobacco Control Act went into effect. So one flavor in particular I wanted to highlight was diacetyl. So this is a chemical that's been found in buttered flavored foods such as microwave popcorn, and we've known since the 90s that diacetyl has been linked to a serious lung disease called bronchiolitis obliterans. So it was coined the nickname popcorn lung, and this was because this serious lung disease first showed up in a Missouri popcorn factory by workers just inhaling this chemical. So much where 8 of the workers had irreversible lung damage that they could only get a lung transplant as their only treatment option. And so in a study of over 50 different types of flavorings sold by the leading e-cigarette brands, researchers found that the chemical diacetyl was found in 76% of these e-cigarette flavors, or 47 of those 51 unique flavors that were tested, even though we know it's linked to popcorn lung. So menthol, I want to talk about menthol. It's a chemical that's naturally found in peppermint and other mint plants, but it can also be made in a lab. And so menthol was first added to tobacco products in the 1920s and 30s to reduce the harshness of the cigarette smoke and the irritation from nicotine. So suppressing coughing, really giving smokers the illusion that, oh, they're breathing more easily because of the menthol. While tobacco companies, they have relied on that soothing and cooling effects of menthol to make cigarettes more appealing to new smokers, to youth, and to certain racial and ethnic groups, especially African Americans and Black communities. And so menthol cigarettes have been found to increase the likelihood of becoming addicted to nicotine, and also they've been linked to the degree of addiction. So menthol smokers are less likely than non-menthol smokers to successfully quit, despite having a higher urge to want to quit. And so about 18.6 million people in the US currently smoke menthol cigarettes. And again, the tobacco industry has targeted certain groups, looking that 85% of African American and Black smokers, 47.7% of Hispanic smokers, 41.1% of Asian smokers, and 30.3% of white smokers smoke menthol cigarettes. They're very, very popular. And then looking at youth who smoke, they're more likely to smoke menthol cigarettes compared to older smokers. So looking at our government actions, I mentioned in 2009, with the Tobacco Control Act, the FDA removed all flavored cigarettes except for menthol from the marketplace, and that was just for cigarettes. In 2020, the FDA banned flavored pre-filled cartridge-based e-cigarettes, again, except for menthol. And in earlier this year, the FDA announced that it is planning to propose tobacco product standards to ban menthol as a flavor in cigarettes and to ban all flavors, including menthol, in cigars. And so in 2009, when that flavor ban happened to cigarettes, we did see an uptick in the use of flavored cigars because of that. And so finally, looking at e-cigarette aerosol, that white puff cloud that you see that someone takes off of an e-cigarette device. Again, it's not harmless water vapor. The e-cigarette devices emit that aerosol. So just how there's secondhand smoke, there is secondhand aerosol, which can contain many different chemicals, including nicotine. And as you can see too, a lot of other chemicals, ultrafine particles that can get really deep into the lungs, flavoring chemicals like diacetyl as well, and those cancer-causing chemicals can all be produced in secondhand aerosol. So you might be wondering, well, how much nicotine is in an e-cigarette? Unfortunately, there's no product standardization, so nicotine levels are highly variable between the products, with some reaching or exceeding levels that are found in traditional or combustible cigarettes. Again, the nicotine concentration has doubled over time. The nicotine also varies based on the device and experience level of the user. So some devices allow for device manipulation. So the more heat you have, the more nicotine you're going to get, but also the more other chemicals like more formaldehyde and things like that. Over time, these devices have gotten more sophisticated. So looking at the first generation of products compared to the fourth generation of products, they can get a lot hotter and heat that e-liquid solution to a higher temperature. Some products contain nicotine salts. So nicotine salts, they lower the pH of the e-liquids, which really allows for a higher level of concentration of nicotine to be delivered with less irritation. So those are going to be your Juul-like products. And then, of course, labeling. Labeling is not always a reliable indicator of the nicotine content in these products. There have been several studies done, one of which looked at samples of e-liquids from the 7 most popular online U.S. manufacturers and distributors. And what they found is that nicotine was detected in 91% of the samples. So again, these samples were supposed to be nicotine-free, but nicotine was detected in 91% of those samples. So this shows you how Juul imitates combustible cigarettes. And so that gold line represents nicotine from cigarettes, how it's absorbed and stays in the bloodstream. And the pink line represents the Juul device. So notice how it resembles that gold line. So Juul was designed to deliver nicotine just like a cigarette. And this is really due to the nicotine salts allowing a higher level of nicotine concentration to be delivered. And so clearly e-cigarettes are becoming big issues for our schools and children, with e-cigarettes being the most commonly used tobacco product among Indiana youth, with about 1 in 5 Indiana high school students reporting using any tobacco product. And again, e-cigarettes is what's most popular among our middle school and high school students. And so e-cigarettes are most commonly used by others who use other tobacco products. So again, that dual use, and that is common among all age groups, with almost 40% of current adult e-cigarette users also being current cigarette smokers as well, so using more than one product. And then the NASAM, so the National Academy of Sciences, Engineering, and Medicine, they came out with a report in 2018 that found that substantial evidence that e-cigarette use increases risk of ever using combustible tobacco products among youth and young adults. And so e-cigarette use is a strong independent risk factor for the initiation of cigarette smoking among adolescents and young adults. So young adults who use e-cigarettes, they're 4 times as likely to begin smoking within 18 months compared to their peers who do not use e-cigarettes. So not only are they getting addicted to the nicotine in these e-cigarette products, within 18 months, they are 4 times more likely to start smoking traditional cigarettes. And then among young adults, e-cigarette use was most associated with more frequent cigarette smoking and more intensive cigarette use. So looking at the health effects of these products relating to COVID-19, e-cigarette users are 5 times more likely to test positive for COVID-19 than those who do not use e-cigarette products. And dual users of cigarettes and e-cigarettes are nearly 7 times more likely to test positive for COVID-19. So really thinking about how people share these products, the hand-to-mouth motion, really putting people more at risk. And then, of course, we do know that those who smoke are more likely to have severe illness from COVID-19. We do know that the e-cigarette and vaping products, that they contain nicotine, which has known health effects. It's highly addictive, it's toxic to developing fetuses, and is a health danger for pregnant adults and their developing babies. In terms of looking at adolescent and youth harm, it does harm their brain development. So the brain continues to develop through the 20s, and it harms their development, making them more susceptible to nicotine addiction. Also, it makes it more difficult for them to quit and puts them at a greater vulnerability of addiction to other substances in the future. And it's really targeting the spots in their brain that's linked to attention, so reducing their attention span and enhance impulsivity during adulthood. Continued health effects. There is e-cigarette use is associated with having increased odds of having chronic cough, phlegm, and bronchitis, as well as asthma diagnosis. E-cigarette users do have higher odds of myocardial infarction, so heart attack, stroke, depression, anxiety, emotional problems, and circulatory problems compared to non-e-cigarette users. And in October of 2019, there was the first study to link e-cigarette use to cancer among mice. So researchers found that mice who were exposed to e-cigarette aerosol for 54 weeks, that they developed carcinomas of the lungs and abnormal bladder cell growth. Then, of course, you might have seen news stories that these products can cause unintended injuries with fires and explosions, and of course, accidental poisoning among children and infants. And again, as I mentioned before, long-term effects of these products are unknown. So new research is continually coming out. So recommendations on e-cigarettes, the U.S. Preventive Services Task Force, a group of experts that come out and tell us when to get, our mammograms or colonoscopies. They've reviewed the evidence and they found that the current evidence is insufficient to assess the balance of benefits and harms of e-cigarettes for tobacco cessation in adults, including pregnant persons. So they really recommend sticking with the proven methods with proven effectiveness and established safety, which is behavioral counseling combined with tobacco treatment medications for the greatest likelihood of achieving abstinence, of achieving tobacco recovery. And so I do want to note that the FDA has not approved e-cigarettes as a quit smoking aid. They are a tobacco product and they're regulated as such. And so more research is needed in this area to better understand the health effects of these products. So there are available resources out there that you can utilize and promote in your community. So there's Vape Free Indiana. That website has a lot of great resources for parents, for youth, educators, as well as health professionals. And there's so many different media campaigns. So the Behind the Haze is a mass media campaign to really highlight these harms and promote cessation among youth. This is Quitting is a text-based cessation program. So youth and young adults can text the code word Indiana to the number on your screen, 88709, to help quit vaping. So it's a text-based program that they can do to try to quit vaping. Live Vape Free is a newer program that supports both parents and caregivers and youth. So for parents and caregivers, it's an online learning program that can educate them to help them support their child, really to learn more, go through those online modules to support youth to quit vaping. And for youth, it's another program, another tool in the toolbox to help them quit. And then the real cost of vaping, that is another campaign. This one is from the FDA, and it has lessons and activities that teachers can utilize, including resources and digital tools, but it has a curriculum for teachers to be able to implement among their students. And so you can access these resources from the PDF. You can click on the links there that are underlined in order to gain access to these different websites to learn more about the programs. I do want to highlight the Indiana Tobacco Quit Line, 1-800-QUIT-NOW. This is a free and confidential telephone and online support that helps all Hoosiers quit all forms of tobacco. And so there is a program for youth. There's different programs for population, but for youth, they can help youth ages 13 to 17 quit all forms of tobacco, including e-cigarettes. So people that enroll in this program receive free quit support materials. They get pre-arranged calls with a trained quit coach, and they can get access to an online community with others just like themselves trying to quit, and can access free nicotine replacement therapy, or NRT, if they're eligible. And of course, people can call into the Quit Line an unlimited amount of times. Again, that number is 1-800-QUIT-NOW, and you can learn more at quitnowindiana.com. I do want to highlight the Quit Line's behavioral health program. So this program is for callers who have a behavioral health condition and want to enroll in the Quit Line services. So this is an enhanced program where they have 7 pre-arranged calls with a quit coach, and they can receive a 12-week regimen of combination nicotine replacement therapy. So callers that enroll in the behavioral health program can receive the nicotine patch plus the nicotine gum or lozenge to help with cravings. They also get a letter sent to their healthcare provider informing the provider of a quit attempt. And so it's free to enroll in the behavioral health program. They just need to qualify. So it's self-attestation. So there's 2 eligibility questions you see on the screen now. And individuals that call just have to say yes to these questions to be offered enrollment. So here are additional resources that you could utilize and promote as well. The ones at the top, Become an X, Nicotine Anonymous, Quit Start, and NCI Quit Pal. Those are for those who are trying to quit all forms of tobacco. And then resources for health professional and advocates. There's a Truth Initiative, RX for Change. Purdue College of Pharmacy has CE programs too to learn more about tobacco cessation, and pharmacies. So quitsmokingpharmacies.com. Here in Indiana, there is a statewide protocol which gives pharmacists the authority to prescribe the quit smoking medicines and help provide patients with counseling. So you can always refer patients to your local community pharmacy. So thinking about what your LCC can do, there's a ton of different things that you can do in terms of tobacco treatment and promoting tobacco recovery. You can promote awareness through youth prevention activities. And I think what always goes best is promoting with a national observance. And so September is National Recovery Month. So there's also tobacco recovery that you can promote. The 3rd Thursday in November is always the Great American Smokeout. So this year it's November 18th, where we really challenge those who smoke to quit just for a day. November is also Lung Cancer Awareness Month. You can capitalize on that. And then, of course, always New Year's resolutions, too, that you can help promote prevention and cessation among those that are currently using tobacco. You can also share the Indiana Tobacco Quitline materials. You can order free materials, again, from quitnowindiana.com. There's also free posters that you can share and promote. And then healthcare agencies. If you are a part of a healthcare agency, your agency can enroll for free as a preferred provider of the Quitline and get free privileges to send referrals of your patients to the Quitline. So again, check that out. You'll have the PDF that you can click on these links to access those web pages. You can create vaping education kits. So, maybe you put together some of these materials, those Quitline cards, and information on vaping products too, and resources to the Quitline, put them in little vaping kits to be able to easily distribute or promote during certain events. You can also advocate for comprehensive tobacco-free policies, so advocating among schools, healthcare organizations, really to include also these e-cigarette products, encouraging folks to improve their signage and really assist with enforcing the policy as well, informing people who are violating the policy that, hey, you're violating the policy, I'm going to have to ask you to step off of campus. Happy to provide you with free information about quitting from the Quitline. You can also advocate for tobacco tax increases. Again, it's proven ways to help prevent youth initiation. You can write letters to the editor to create awareness that way. And if you're in a healthcare organization, you can train your staff in evidence-based tobacco treatment interventions and dedicate staff to work with patients. That could include a tobacco treatment specialist training as well. You can host group cessation classes and have tobacco-free breaks during groups. So instead of a long 20-minute break where people go out and smoke, say, hey, we're going to have a tobacco-free break, and maybe have shorter breaks, but more frequently. And then also offering nicotine replacement therapy during group treatment classes so people are encouraged to use these products and not go out and smoke. And so in summary, these are all the things that we've talked about, really showing you how Indiana is failing in many key areas that are proven to help prevent youth initiation, decrease tobacco use, and increase evidence-based treatments. Disparities in tobacco use do exist, really, which highlights the importance of properly funding our state tobacco control programs and prohibiting flavored tobacco products. E-cigarettes, they're not a safer alternative to tobacco products. They contain nicotine and other harmful chemicals and flavorings, and the FDA has not approved these products to help with quitting. And there are a variety of free resources and support out there for those who have questions about quitting or are interested in quitting and want to learn more. So again, my name is Kayla Sue. I'm with Rethink Tobacco Indiana. You can check out our website, rethinktobaccoindiana.org, for more information. Thanks.
Thank you, Kayla, for sharing your valuable information with us. Wow, it was amazing. I learned new things today as well, so I'm really thankful today. If anybody is interested to know more about the tobacco-related opportunities, I would encourage them to check the website of the organizations that are available on the resource pages. And if anybody is interested to take a specific action as an LCC, please check our call to action a slide, and it will be really helpful. Thank you so much for your time. Have a good one.